Everyone, my name is Mavish Hassan and I will be presenting a comparative analysis of the USA and Pakistan healthcare system. USA, being a developed country, has a better healthcare system as compared to Pakistan, but at the same time, both countries are facing many challenges and there's a lot of room to improve their healthcare system. For health insurance mechanism, the United States and Pakistan differ in several ways. In the United States, health insurance is predominantly provided by private insurance companies, with some government programs such as Medicaid and Medicare covering certain segments of the population. Health insurance products in the US are varied, with different plans offering different levels of coverage, deductibles, and premiums. In Pakistan, health insurance is also primarily provided by private insurance companies, although the government has launched initiatives to increase access to healthcare for the population. Health insurance products in Pakistan are relatively limited, with many people lacking access to insurance coverage. The healthcare industry in Pakistan is less developed than in the US, with a lower level of specialization and technology. However, healthcare in Pakistan is generally less expensive than in the US. One significant difference between the health insurance mechanism of the two countries is the extent to which insurance is used to cover healthcare expenses. In the US, health insurance is commonly used to cover the cost of medical treatment, including hospitalization, surgeries, and prescription medications. In Pakistan, health insurance is less commonly used, with many people paying for healthcare expenses out of pocket. For provision in the USA, hospitals and clinics can be owned by a variety of entities, including private for-profit companies, private non-profit companies, publicly owned entities such as government-run hospitals, universities, and academic medical centers, physician-owned practice. In Pakistan, hospitals and clinics can also be owned by the government, private for-profit companies, private non-profit organizations, charitable trusts and foundations, religious organizations. Again, in the USA, doctors can work for a variety of entities, including hospitals and clinics, private practices owned by either the doctor themselves or a group of doctors, government agencies such as the Veterans Administration or the Department of Health and Human Services, universities and academic medical centers, non-profit organizations such as community health centers or free clinics. In Pakistan, doctors work for government-run hospitals and clinics, private hospitals and clinics owned by for-profit or non-profit organizations, non-government organizations such as ADI Foundation and Shaukat Khanum Memorial Cancer Hospital, academic medical centers and university, military hospitals, and clinics. Training the USA, the planning and training for filling vacancies in healthcare workforce is typically done through a combination of government and private sector efforts. The federal government provides funding for and collaborate with the state and local governments. In Pakistan, the federal and provincial governments have established various programs and initiatives to develop the healthcare workforce, including the establishment of medical colleges and universities. In the USA, medical students can receive financial assistance through scholarship grants and loans from various sources. Residency training is typically paid for by the hospital or healthcare system. In Pakistan, medical training is primarily funded by government. Students typically pay much lower tuition fees than their counterparts in the USA. And after training, physicians undergo several years of postgraduate training, which is paid by hospital or healthcare system in Pakistan. Although in the USA, healthcare reimbursement is primarily handled through insurance companies, where they are private or public. Whereas in Pakistan, healthcare reimbursement is typically handled through a combination of private insurance and out-of-pocket payments. For capital expansion for healthcare organization in USA, healthcare organizations may finance capital expansion through a variety of sources, including loans from banks or financial institutions, public or private grants, donations, and investments from private individuals or organizations. Whereas in Pakistan, capital expansions for healthcare organizations is usually financed through a combination of public funding and private investment. Public funding may come from government programs or international aid organizations, while private investment may come from local or international investors. For quality and levels of satisfaction in the USA, healthcare system is generally considered to be one of the most advanced and sophisticated in the world, with a high level of medical technology and well-trained healthcare providers. There are also concerns about the high cost of healthcare, which can limit access to care for many individuals. Whereas in Pakistan, the quality of care is often poor, particularly in rural areas, where access to healthcare is limited and the healthcare workforce is less trained and less experienced. Overall, the quality of healthcare in the USA is generally considered to be higher than in Pakistan. However, both countries face significant challenges in providing access to high quality healthcare service to all individuals, particularly those living in rural areas. In the USA, despite the high cost of healthcare, many individuals report high levels of satisfaction with the quality of care they receive. According to a 2020 survey conducted by the Commonwealth Fund, 75% of adults in the USA reported being satisfied with the quality of their healthcare. In Pakistan, the level of satisfaction with healthcare service is generally low, particularly in rural areas. A 2019 survey conducted by the Gallup Pakistan organization found that only 29% of Pakistanis were satisfied with the quality of healthcare they received. For health outcomes, USA and Pakistan has very striking differences. In infant mortality, USA for infant mortality rate, USA is 5.8 deaths per 1,000 live births, whereas Pakistan is 49.3 deaths. It's one of the worst in the world. For life expectancy, USA is 76.1 years, whereas Pakistan is 67.3. Vaccination rates for USA is 80% of children aged 19 to 35 months in the USA had received recommended vaccinations, and over 90% of adolescents aged 13 to 17 had received the recommended HPV vaccines. Whereas in Pakistan, according to WHO in 2019, the vaccination coverage for the third dose of diphtheria, tetanus, and pertussis vaccine was 66%, and the vaccination coverage for the first dose of measles containing vaccine was 73%. So health outcomes in Pakistan are very poor, and it's much worse than USA. For long-term care and cost of the system, in USA, long-term care is primarily provided by nursing homes, assisted living facilities, and home health agencies. According to CDC, approximately 1.3 million people reside in nursing homes in the US, and another 800,000 receive care in assisted living facilities. Medicaid is a primary payer for long-term care services in the USA, although some individuals may also have private insurance or pay out of pocket. The cost of long-term care can be significant, and many individuals and families may struggle to afford it. In Pakistan, there is a lack of formal long-term care services, and most care of older adults and individuals with disabilities is provided by family members. There are a few government-run nursing homes and hospices in major cities, but they are often overcrowded and underfunded. The cost of long-term care in Pakistan is generally lower than in the US, but there are still significant financial barriers to access care. Some of the current threats to healthcare in the United States is access. For USA. It's despite the Affordable Care Act expanding access to healthcare, many Americans still lack health insurance, making it difficult for them to afford medical care. Next, the opioid epidemic is a major public health crisis in the United States with thousands of deaths each year. Another is racial and ethnic minorities in the United States continue to experience disparities in healthcare access and outcomes, including higher rates of chronic disease and lower life expectancy. Pakistan's healthcare system is severely underfunded with insufficient resources to meet the needs of its population. Pakistan faces a high burden of infectious disease, including tuberculosis, hepatitis, and polio. Malnutrition is a major health issue in Pakistan, with a significant proportion of the population suffering from stunted growth and underweight. Political instability in Pakistan has led a lack of investment in healthcare infrastructure and inability to implement health policies effectively. Rural areas of Pakistan often lack access to basic healthcare services, and even in urban areas, many people cannot afford medical care. There are things happening in both in USA and Pakistan. For USA, current changes include the Affordable Care Act, also known as Obamacare. It expanded access to healthcare for millions of Americans, prevented insurers from denying coverage based on pre-existing conditions, and created healthcare marketplaces where people could shop for insurance. COVID-19 pandemic has led to a significant shift in how healthcare is delivered in the United States. Telehealth services have become more widely used, and hospitals have had to adapt to a surge in patients with the virus. In Pakistan, there are health card system. It was launched in 2015, providing free healthcare services to the poor and vulnerable population of the country. The scheme has been expanded to cover more districts and is expected to benefit millions of people. Sehat Sahulat Card was launched in 2016, aims to provide free healthcare services to families living below the poverty line. The program has been expanded to cover more services and beneficiaries. Digital Health Initiative is launched by the government of Pakistan to improve healthcare delivery and management. It includes development of a national health information system and the use of telemedicine to provide healthcare services in remote areas. Pandemic response, like in the United States, the COVID-19 pandemic has significant changes in Pakistan's healthcare system. Hospitals had to rapidly expand their capacity to deal with the surge in patients, and there has been an increased focus on improving public health infrastructure and preparedness. These are the references. Hope you enjoyed the presentation, and I'm looking forward for the feedback. Thank you so much.